Now, between the ongoing race for coronavirus treatments and vaccines, as well as the rise of genomics and telehealth, stocks in the medical sector continue to demand attention. Here to help us break down the latest developments in this space is Nina Deka, Senior Research Analyst at ROBO Global. Thanks so much for joining us today, Nina.
Thank you for having me.
All right, so there are a lot of companies that are developing coronavirus vaccines, and you turn on the news or look at your computer and there are just headlines aplenty. It's all about that race for the vaccine. So very much in focus right now for investors in particular. So can you give us an overview of what you're seeing right now in the vaccine race?
Sure. Like you said, it's in every headline and it's a focus and it's very important because we do need a vaccine. And I do believe we're going to get there. And I believe it's going to be more than one company that gets us there. And they're probably, they're going to be very close in timing is what I imagine. So if not by the end of the year, by early next year, we should have, there's already 3 to 4 promising looking candidates based on phase 1 data. Couple that have already entered into phase 3, and they're doing multinational clinical trials with 30,000 people in some cases. So we caution investors in trying to just pick one winner and really look more toward the long term and look at what these individual companies are doing when looking to make investment decisions and use that as more of a guide in how to determine which companies you might want to bet on for the long term.
Yeah, because as you're alluding to, there's a lot of volatility with these stocks that's tied to that news, both positive and negative. So that makes it tough to pick the true winner there. But in addition to the vaccine race, let's talk about the genomic space and the contributions we're seeing there in terms of coronavirus therapeutic efforts.
Sure. So, I mean, one of the reasons why companies like Moderna were able to develop a vaccine to begin human trials so quickly was because they were able to sequence the genome of the virus and identify it from January. And that was done on Illumina sequencers. Illumina is one of the companies in the HTEC index, the Healthcare Technology and Innovation Index that we manage through research. And so Illumina is up 17% year to date. Last year, as of last year, they had over 15,000 sequencers placed around the world. And so they basically already laid the groundwork as gene sequencing pioneers that enabled us to accelerate the development of all these therapies and vaccine for the coronavirus. Another interesting company is Regeneron. They're not developing a vaccine per se, but they're working on genetic engineering technology, whereby they're using monoclonal antibodies to work on treating the coronavirus. And they're hoping to begin clinical trials this summer. And this is important because, again, this is an unprecedented pace as to how quickly they were able to develop an antibody cocktail to put into clinical trials. So really exciting things happening there. And it was, if you look at their history, it was the innovation that they had around past coronaviruses as well as Ebola that enabled them to get smarter and faster and learn more to help develop these therapies quickly. So when I'm looking at investing for the long term, I look at companies like Regeneron and Moderna and I say, it's not what they're doing right now with coronavirus, it's what they've already done. You look at their rich pipeline and these companies have a long runway for growth in many other therapeutic areas well beyond the coronavirus for a really long time.
Yeah, that's an interesting point that you bring up about the long term, because when it comes to these pandemic efforts, this isn't going to be a huge profit play here for a lot of these companies, right?
Not necessarily expected to be. And so that's why I would once again go back to the bigger picture. Moderna has over 20 other different therapies in the clinical trials right now. This is a company that's pioneering mRNA therapy, which doesn't even exist on the commercial markets today. So any one mRNA therapy that gets approved is going to be a positive catalyst for the rest of the space. And Moderna's got over 20 other candidates in clinical trials. They're working on vaccines for Zika, CMV, RSV, and also HIV, which continues to have 1.8 million new infections per year, and there's still no vaccine for HIV. They're working on Zika. So all it takes is one to win. and for everyone to get excited about all the other therapies that are under development.
And elsewhere in the medical sector, due to social distancing, telehealth has, of course, been on the rise. And we've been following at IBD Teledoc very closely. What are your thoughts, speaking of profitability, on the path to profitability for a business like that? Teledoc, it's seeing huge sales right now, huge sales growth, but that's not necessarily translating to the bottom line as of this moment.
Well, the company continues to have increasing margin profile, which is interesting because 5-6 years ago, when the core business was predominantly general medical visits used to treat urgent care needs, the long-term prediction was that gross margins would decline over time as utilization went up, because the actual patient visits tend to have lower margins than the subscription revenue of this company. So what we're really saying here is that that trend didn't happen. They were able to maintain their margins, and the reason why is because they've invested in other areas like second opinions, for example. So people who have been diagnosed for cancer or need to get expensive surgery for some reason are given access through a service that Teledoc offers to contact another world-leading physician to review their records and see whether or not, in fact, they recommend getting this procedure done. So not only is Teledoc able to prove that they can save their clients money on fewer emergency room visits because they're able to, say, treat low acuity urgent care needs on a doctor visit, they're also able to save thousands of dollars in potentially reducing unnecessary surgical procedures. So they're branching into all of these other areas like behavioral health, dermatology, smoking cessation. And so when you look at all the growth opportunities across the board, their ability to drive value across more than one area is able to help sustain their margins over the long run.
Circling back to the beginning of our conversation and about picking winners in this broader space, especially when investors are trying to capitalize on perhaps the coronavirus efforts in particular, as well as these broader trends that you're talking about, the HTEC ETF that you've mentioned has names like Quidel, Thermo Fisher, Intuitive Surgical among the top holdings. Those are a lot of names that we've been covering as well. And this is an index tracking ETF. Can you talk about that aspect a little bit?
Sure. So there's a couple of things that differentiate this ETF from some of the other ones on the market. And I think there's a lot of different ETFs for every different type of investor appetite. And what differentiates us is several things. First of all, we use research. We actually have a team of research analysts and also a strategic advisory board that is comprised of some of the foremost thought leaders across different areas of robotics, automation, and AI, that we tap into all these brains to put together what we believe is a proprietary set of subsectors. So when we look at healthcare, we're exclusively focused on healthcare technology and innovation. And so we developed a proprietary list of subsectors, the areas that we believe represent the next 10 years of disruption: genomics, robotics, precision medicine, telehealth, data analytics. And we look for the top number 1, number 2 technological, market-leading, world-class players around the world. So it's not just US based. And so what you get as a result is a portfolio of companies in an index. There's about 80 or so that are diversified across these areas. And so if you look at HTEC, it's up 25% year to date. When you compare that to other ETFs like XLV, which is up about 6% year to date, and truly a benchmark, what this is telling us is that there is a growing investor appetite for technology and innovation. And then when you invest in these areas that are across the different subsectors that I described, what you get is a portfolio that's more heavily weighed in small and mid-cap companies than your traditional standard ETF that tend to be cap-driven. So I mentioned XLV and other strategies out there. They're great strategies, but they tend to be more heavily weighed in in mature, stable, large cap pharmaceutical health insurance companies. And so those are great strategies for some investors, but ours is looking to meet the need of the investor that wants exposure to all of these high growth innovative areas over the next 5-10 years.
Yeah, well, there's a lot of innovation going on in that space right now. So Nina, thanks so much for coming on the show and breaking all of that down for us.
Thank you for having me.